what is this now? They've withheld the export of those materials into Ghana.
No, we've been able to secure some of the consumables. In fact, the decision to reduce our out was that we're running low on consumables, and because of the debt, the outstanding debt, the supply had been withheld, and so we managed to find some money to pay them, to pay something which enabled them to release more consumables to us. In fact, it was during that period that the outpatient services was restricted.
And the question that was asked directly was, when will you open it?
Exactly. So we are now engaged with government, with the ministry, with other stakeholders to see how quickly we can, find the resources to advance. Because at the moment we are sitting in a 4 million city hole, and so and every session of dialysis that we do, because if you look at the current, if we are to operate at our current capacity, which is about 2,000 dialysis sessions every month, then it means that we are going to accumulate about 961,000 cedis of debt every month, in addition to the 4 million cedis that we have already. So this is financially unsustainable, and that is why we are also in discussion to see how this can be ameliorated.
Okay, so that's back to the question: when will you open?
We are hoping to get a breakthrough in terms of getting some advancement in terms of funds, so that once that is secured, then we can be able to open the service out fully. But as I said, we are still open for emergency. So if any patient, the situation becomes critical and it's an emergency, we are still open to treat those. We are still treating emergencies.
So for clarity, as we speak tonight, you can't tell when exactly the OPD will be open.
Yes, exactly.
You can't tell?
I can't, yes.
Okay, and then fundamentally because you don't have consumables, enough consumables?
No, we have the consumables. Don't get me wrong.
Okay.
We've secured the consumables. But if we deploy the consumables now at the current rate, we are under recovering. So
and raise the funds to pay.
Exactly.
Okay.
So so then we'll still, it will become a vicious cycle. Then in the end, we may not even be able to do the emergencies and the inpatients. And so at the moment, we are providing the service at the old price for inpatients and for anyone who comes in as an emergency.